You're watching PCTV Channel 17, proudly serving the Port Clinton City School District community. The following is a production of the Port Clinton High School Digital Media class.
Welcome to Time for Health. I'm your host, Rachel Fall, and we're very glad you've joined us. We hope you gain something from the program that helps you and your loved ones. We want to arm everyone with as much information as possible so we can all make good choices. And this is not to take the place of regular medical care, so be sure to include your healthcare provider in on your plans and your conversations. And today our topic is patient safety, and we have a whole team of people here. But we're going to start out with Linda Oman. You do risk management and performance improvement at Magruder Hospital, and Christy Malakis, you're a veteran of the program, the pharmacy administrator. So thank you for being here, both of you.
Thanks for having us.
Linda, patient safety kind of sort of lives in your department. So talk a little bit about what it is. There's a certain week of awareness, but it obviously goes well beyond that. Talk a little bit about that.
That's right. This year, March 13th through the 19th is designated National Patient Safety Awareness Week. And the theme this year is United in Safety. And at Magruder Hospital, we really embrace that United in Safety. We partner with patients and their families and each other to make sure that patients are safe from harm. And that doesn't mean just when they're in the hospital, but previous to that. Patient safety really came into play after the 1999 Institute of Medicine's report that came out after their research that said that between 44 and 98,000 people die every year from medical error. And that was kind of a wake-up call for healthcare providers, because anybody that goes into healthcare to help people, not to harm them.
Right.
And so since that time, there's been a real awareness on how we can make things safer, not just in the hospital, but also for patients before they come to the hospital, because patient safety starts well before they enter our doors. It seems that hospitals in this country have been working toward making patients safer, and Magruder Hospital is right in there with the rest of the nation, trying to make sure that people are safe.
Right.
So you'll hear more on the things that we're going to talk about today, but the important thing to think about is that patient safety starts really in the home, because a patient usually comes to the hospital more often than not for something that happened, whether it's a fall or an infection or something. So there's a lot of things that people can do at home to keep themselves safe before they even reach our doors.
Right. It's, I know, there's a week of awareness, but it's, that's not the only week that we pay attention to these things. There's a ton of things that go on behind the scenes that we're going to hear from everybody today. But there's things that people can do from at home or in the community, with themselves, with their loved ones, with other people. And then the hospital does, like I said, a lot of things in the background, a lot of tracking, making sure, checking patterns. Talk just a little bit about that kind of stuff.
Anytime that something happens in the hospital that is not the normal, whether it's a missed test or a medication error or a patient fall, those are all reported immediately. And we take that information, we track and trend it, and if we see that something is happening more often than what it should, or it caused patient injury, then we will put a performance improvement effort into it and try to address what the root cause was, and then change our processes so that we decrease the risk of something like that happening.
Okay. So there's lots of tracking and things going on behind the scenes that people will probably, and I wouldn't want to know all the things, all the tracking and reports that you do.
That's correct. And it's funny when you talk about doing things to stop harm from happening. We have a lot of feedback from patients. So why do they always ask me my name and birthday? And that's one of the things that every hospital does, is they've identified 2 specific patient identifiers that they're going to ask anytime they provide medication or treatment or before surgery, and that's always the patient name and birth date. And it might be your best friend that comes in, but you really, if you're a caregiver, you really should be asking that every single time and checking it against their wristband and their orders to make sure that we have the correct patient, the correct treatment, or test or medication, just things like that that
seem annoying, but they're done for a reason.
That's right. That's right. It's not that we don't know you or that we want to just hear you talk, but
yeah. Okay, Christy, pharmacy, medications. It's like Pandora's box.
It certainly is, and we've talked a lot about this.
Yes, we have. So in terms of patient safety, again, the Awareness Week, but also all the time, there's certain things that you and all pharmacists really want to make people aware of. Talk about those things.
Right. I think the number one, if we talk about the top 5 things that I would consider, if Linda talked about Safety Week, to tie into that with medications. The first thing is always keep that medication list. Keep it handy, keep it updated. Write down what you're taking, both name brand and generic. A lot of times you'll say a generic and we'll know it by the name brand because of that nice marketing from those drug companies. Write down your dose, so if it's 20 milligram, if it's 5 milligram, how often you take it, and keep that updated. So if every time you go to the doctor, if that gets changed, come home right away, make that notation so that it's fixed every time. We'll see patients come in to the emergency department or get admitted, and if they don't have that updated list, there's always that risk that if we prescribe something that they get inpatient could interact with what they're currently taking. And we also want to make sure that we keep with that same regimen so that they don't lose ground on any chronic disease that they're being treated for.
Over-the-counter stuff, herbal, should all that be included on there?
Yep. And we talked about interactions, and that sort of goes into the number 2 is keep aware of any interactions that you might feel or that you need to be aware of, and that includes over-the-counter drugs and any supplements that you could take. So food, drugs, alcohol, all of those things can interact with your medications. And the best way to get that information is from your label. Those little, they're called auxiliary labels. There's those little bright labels on your bottle that will say, don't drink alcohol, this might make you dizzy.
Eat with food.
Right, eat with.
Or take with food, yeah.
Take with food, right. And then a lot of times the medication comes with education they all come with education, but sometimes it's pretty extensive.
Yeah.
You will find good information in there, so you can take the time, you should take the time to sit down and read that. That's really important also if you're seeing different providers, different specialists, that everyone's aware of what you're taking, especially those OTC supplements that you mentioned, because those can interact with prescribed medications as well. Sometimes we forget about those. Or if you say, hey, I just started this daily aspirin regimen, well, that can completely interfere with a lot of other medications that you're taking. And then the third thing I would say is to take medications as they're prescribed. So we're very good at Googling things and replacing this as a medical license, which I'm sure just all of our practitioners around love that. However, don't think that because you research something on your own that substitutes your doctor's advice. Don't skip a dose because you feel a certain way. Don't take an extra dose because you missed one. You should always consult your doctor or your pharmacist for that advice. If you think about it, medications are designed to help us, and they work in a specific dosing pattern. We have to take so much to get us to a certain level. So if we're not taking them how they're prescribed, that benefit isn't going to be there, and we're not going to see those results that the medication is designed to work. If you do have side effects, don't just stop taking it. Talk to your doctor. There's medications you can take to treat the side effects, and then there's ways or other options that we can work with to help eliminate those or alleviate those. On the topic of patient safety, the fourth thing I would say is to store your medications safely. So we've kind of directed this toward adult patients, but storing your medication safety is really for kids. While we're talking about patient safety, did you know, Rachel, that 3 out of 4 emergency room visits for children are related to accidental poisonings?
I didn't know.
So 75% of the time that kids come into the ED is related to getting into a medicine cabinet, getting into your purse on the ground, somewhere where a pill bottle should not have been. So the best thing to do is, even if you don't have kids in your house all the time, make sure that they're stored high in a secure location every day, so that, oh hey, the grandkids are coming over, we have to move all of our drugs.
Right.
You're not going to remember to do that every
forget.
time. So just do it to begin with. Store them safe. And also remember to not store them in the bathroom. It's really humid in there, and that humidity can degrade medications and make them less active. Clean those cabinets out regularly. I think every time I'm on the show, we talk about taking your antibiotics until they're gone.
Yes.
So I always have to put that plug in there. That increases antibiotic resistance when you don't take your antibiotics, even if you're feeling better. So take those fully. So you shouldn't have any leftover antibiotics ever. But if you do have any ever leftover medications, pain meds, anything else you didn't take, make sure you check those expiration dates, OTCs, your Advils, your Tylenols, and follow those. Ottawa County we're very lucky to be here and have that drop box at the local police station to get rid of our medications. But when in doubt, if you're suspecting an accidental poisoning, the poison control number is 1-800-222-1222. So it's an easy number to remember. And the last thing I would say for Patient Safety Week, for medication safety, is just to be your own healthcare advocate. So if you have a question, something doesn't seem right, ask. Tie your pharmacists into that. Include all your healthcare practitioners into your questions. And make sure that you've got anything answered before you leave that appointment, because if you're thinking about it then, it will leave you before you get home, and you won't remember to ask it when you get home. So ask all your questions and participate in your healthcare. Be responsible for it.
Great advice.
Thanks.
As always.
Thanks.
Thank you. All right, we're going to take a quick break, and we'll be right back with more on patient safety. And we're back talking about patient safety with 2 new faces. Dave Moore, your physical therapy with Lake Erie Sports Medicine and Rehab at Magruder, and Leslie, you're the infection preventionist, which is just, I think, the fanciest title ever.
Thank you.
So thank you both for being here. Dave, you're also a veteran, so I'm glad you came back. So patient safety, talking about from a physical therapy or falling standpoint, that's one of the things we pay attention to in the hospital is fall. So why is falling important besides it hurts when you do it?
Falls account for 30 to 40% of the hospital admissions from our emergency room every year. Injuries related to falls, such as arm fractures, wrist fractures, broken hips, and 1 out of every 3 people over 65 will fall at least once each year.
Okay.
So
That happens a lot.
It happens, yes it does.
Wow. So we want to prevent that. What can we do? What are some of the things that put people at risk for falling?
Impaired musculoskeletal system, for example, osteoarthritis, osteoporosis, weakness in the hips, loss of balance. That can have an impact, huge impact. Cardiac arrhythmias, in other words, an irregular heart rate, blood pressure fluctuations. Alzheimer's disease, dementia, neurologic conditions such as MS, peripheral neuropathy, where you have numbness in your legs, your feet, a history of having had a stroke in the past. Those are all examples. Vertigo is another one.
So these are things that if you have had or have one of these things, you want to be extra careful.
Yeah, yes,
because
absolutely.
they're putting you at risk.
Yeah. Urinary tract infections, vision loss, and hearing loss.
Okay. So these are things that put us at risk. What about things in the home? Things around the home that put people at risk?
Slippery, wet floors are a big risk. Bathtubs, for example. Poor lighting throughout the house. Cluttered, blocked hallways, throw rugs on the floor, stairways that do not have handrails, and improper footwear.
Talk a little bit about what constitutes good footwear.
Well, supportive shoes, properly fitted shoes, and they should have a non-slip sole. Try to avoid high heels. Tie shoelaces. Don't walk around with your shoes untied. If you have any difficulty bending down to put on your shoes or tie your shoes, get a long-handled shoehorn and use that. Don't walk around the house in your stocking feet. Replace any worn slippers that have stretched out and are kind of fitting loose on your foot. Replace those. And any kind of footwear, shoes, slippers, it doesn't matter, should have a non-slip sole, and they should enclose your heel.
Okay, cover the back is the, okay.
That's right.
You got it. You talked about weakness in the hips and different things. What kind of exercises can people do to help improve their safety?
If you are fearful of loss of balance, if you're having difficulty walking, first go to your doctor. First talk to the doctor about it. There are other issues other than musculoskeletal issues that can cause falls. Start there. But when it comes to exercises that encompass agility, balance, coordination, and strengthening are what you want to try to achieve. Examples of things you can do at home, just walking up and down stairs. Make yourself go up and down several times a day. Hiking, dancing, weight training, working in the yard, getting out in the garden, doing that kind of activity all helps to improve strength, but it also helps to improve bone density, which helps in terms of preventing osteoporosis and helps with decreasing the onset of osteoarthritis.
Okay. So things that aren't just, I notice those things are where you're going this way, you're going not just running or walking, but things where you're using all your muscles.
Yes, getting out, doing things outdoors, getting out in the yard. If you don't use it, you lose it, and that's exactly what happens in this case.
Okay. What about things you can do around the home, simple modifications?
There's a lot that you can do. Have a lamp, telephone, and a flashlight right by your bed. Have the access into your bathroom lit. Have night lights. Keep clutter off of the floor. Arrange your furniture so that you've got clear pathways from the bedroom into the bathroom, as well as clear pathways from room to room in the house. Keep cords off the floor in walkways. Don't just cover them up with rugs either. Don't sit on low sofas, low chairs that you have difficulty getting up out of. Clean up spills right away. Don't leave them and then forget about them. Store food, store eating utensils, store cookware that you are using frequently where it's easily accessible. Try to avoid situations where you're climbing up onto chairs, up onto boxes, things that never do that. But don't put yourself in a position where you would even think about doing it. Keep things close at hand. Install handrails on all stairways, and this handrail, in fact, on both sides would be best. And have the handrail about 30 inches above the step, and have it run the entire length of the stairway. Installing grab bars in your shower, installing grab bars by your commode as well. Keep a night light in the bathroom, and you could use a raised toilet seat to make it easier to get up and down off the commode. If you feel that standing balance is a problem, you can put a sturdy plastic chair in your shower and get a shower wand to be able to do a shower bathing while you're sitting.
While you're sitting, so you don't have to stand that whole time. Okay. Yeah. All good things to keep in mind to help us prevent falls, which is not safe, at home or in the hospital. So thank you. Infection control. Keeping track of that, paying attention to patterns. Talk a little bit about some of the behind-the-scenes stuff that you do for tracking.
Infection control relates to the policies and procedures that have been developed to minimize the risk of spreading infection.
Okay.
That can happen through passing bacteria or viruses from one to another.
Okay.
And there's actually a few different ways this can happen. Human to human, infected surface to a human.
Okay.
Common vectors that we call food or water, as well as airborne and droplet precautions.
Okay.
And we have, behind the scenes in the hospital, put together different types of precautions, beginning with standard precautions, which we do use for every single patient, including gloving with any type of contact, and then, of course, hand washing before and after. The next one that we have developed, a precaution, is called contact. That happens when there could be a type of a pathogen that you touch. And then so that includes gloves and then also gowning In addition to that, we have droplet precautions that can include our flus.
Okay.
Typically, they're larger.
That's when we get to wear masks.
That's typically they're larger in nature, exactly. And they typically, if there's a 3-foot barrier kept, that's adequate as well as the mask. And then there's airborne.
Okay.
Airborne are much smaller, and they travel on the air currents and can actually go into our ventilation system. So then we use a further mask called an N95, and then something that's called reverse isolation.
Okay.
So we just make sure that those are followed through within the hospital.
And I know one of your favorite things is hand washing.
That's absolutely
Every
right.
person I've ever talked to about preventing infections, it's all about hand washing. So talk about that. And hand sanitizer
Hand
too.
sanitizing as well. CDC, I have a little paper there, talks about it being the single most important barrier towards passing infection. It's under a broad spectrum called hand hygiene, a broader spectrum called hand hygiene. And those two things, there's hand washing and then just the regular soaps or the antibacterial kind of gels that we use. The hand washing is used when our hands are visibly soiled or they feel grubby.
Yep.
They're also washed before and after using the restrooms, as well as before and after cooking.
Okay.
The hand sanitizers themselves are recommended for the other instances when you're just out and about and you just need to apply, that as opposed to just need to hand wash. They say that they're equally as effective in that regard. The big thing to remember is that it's the length. For the hand sanitizers, we want to keep rubbing, lots of friction until it's absolutely gone. So
Okay.
you don't feel it anymore. And for the hand washing, they say up to 30 seconds, so you can sing a little song like "Happy Birthday to Me" as I'm going through all that. You do that twice, and that should be sufficient time.
So it's about the time, not just,
Exactly, and really getting some
Rubbing.
friction in there.
Okay. So using hand sanitizer is good. Now, is there, I remember a number of years ago, is there a certain percentage of, it has to be 60%?
That's correct. I believe that a few years ago it was 62%. Now I'm seeing 70%.
Okay.
So I think the higher the percentage, the more effective it is in that
Okay,
regard.
so a little something to pay attention to.
Exactly on the back
labels.
when you're looking for what you want to purchase.
Okay. And I'm always amazed when you think about infection control. I wash my hands before I go to lunch, but I open the stairwell door, I pick up a tray, or in my own home, I wash my hands, but then I touch a million different things on the way to the kitchen to do something. And is that how things?
That is
little
a
things
concern
like
as well.
that?
So what I recommend is that after you dry your hands at the sink, that you actually hold on to that paper towel. That is what you open the door with, and then you find a receptacle outside of the bathroom to dispose of that in.
Because not everybody washes their hands, much to your
Correct.
chagrin, I'm sure.
Exactly, and there's lots of things that hang around on those handles and on those faucets and things. So.
And you have to track different infections, like the flu, I'll say, is probably one of the more common ones. You have to track that to see when it's peaking. Is that correct?
Right. There's a significant part of my job is actually tracking things that happen, and I do a couple of different things. Actually, I do 5 or 6 different things. Just to start on a more specific spectrum, every day I receive the reports from our lab at Magruder. They're wonderful, and I get to see if there are any type of blood cultures or any cultures that have come in.
Okay.
And then to see what those susceptibilities are, and then to look back in the patient chart and make sure that they're getting what they need. So I start there. And then if there's any type of communicables at all that we see, things that the CDC has decided we need to report to our health departments for tracking, things such as salmonella, things that do happen but rarely,
Right.
I am responsible for reporting that to our health department as well. In addition to that, we do flu vaccinations throughout our hospital. It's something that's very important to us. It's something that's part of our CMS and Medicaid reimbursement program for. So we just track very thoroughly the patients that have been, the employees that have been vaccinated, and we keep those records. Also, in addition to that, we offer the flu vaccines at different clinics. Beyond that, just want to see what else I have written here. We do yearly TB testing as well with our employees to make sure that there aren't any carriers out there, just to be monitoring that as well. And that's about
I'm
it
thinking
for right now.
a lot of the stuff you do is, again, probably like Linda, a lot of the background stuff,
Absolutely
checking,
right.
reporting, tracking, but really the education for patient safety is not just in the hospital, but in your home, in the restaurant, at school,
That's
wherever you
correct.
are, is
Absolutely.
washing your hand and paying attention to that kind of
Absolutely.
stuff. That's your big message, because we want to prevent infection.
Exactly, prevent the
So-
transmission,
So
absolutely.
you have nothing to track, nothing
Exactly,
to
so
report.
that my job gets easier,
That's
exactly.
right. Okay, by all means. Thank you very
You're
much.
welcome.
All right, we're going to take another break and we'll be right back. And we're back. I want to thank Linda and Christy and Dave and Leslie for being our guests today, talking about patient safety. And again, there's a certain week of awareness about it, but it is 24/7, 365 at the hospital, at home, everywhere you go. Paying attention to things that have to do with infections, medication safety, preventing falls or treating someone once they have fallen. So lots of different things to keep in mind, information for you to use yourself or for others to use as well. You can certainly pass on that information. If you ever have a suggestion for a program or any questions, please send a note to Time for Health, 615 Fulton Street, Port Clinton, Ohio, 43452. Or you can send an email to Mrs. Pelz at the high school, cpelz at pccsd-k12.net. So think about all the things that we talked about on the show today, whether it's useful for you or someone you know. Again, be sure to pass on that information. And until we meet again, I encourage you to make time for health.